it's amazing how the body will allow light touch. Think about the cranium, the head, the skull. If you hit it, it's hard, and it's protecting the brain and other sensitive structures inside the cranium. But if you put light touch on there, you can feel it move.
Welcome to the Dr. Gill Show. This is where we talk about medical matters that matter to you. My guest today is Dr. Sue Overkamp. Welcome to the show, Sue.
What a pleasure to be here with you, Gil. Thanks for inviting me.
My pleasure, too. Sue and I have many mutual friends here in the family practice and let's just say integrative health community here in central Missouri. Mm-hmm. And Sue has a degree in osteopathy. You're a DO, whereas I'm an MD. Mm-hmm. Yet we're both physicians, and I'd like to explore kind of the origins of osteopathic medicine in contradistinction to allopathic medicine, and find out how what makes us similar, what makes us maybe a little different.
Well, osteopathic medicine was founded by an MD named Andrew Taylor Still, and he lived in Missouri mostly in the 19th century, mid to late and barely into the 20th. He founded the first college of osteopathic medicine after the Civil War. He not only was an MD, he was a captain for the Union, and apparently he had viewed medicine as limited at the time. They could do surgery, and there were just very few medications. Most of them were opioid-based, and he was dissatisfied because he wanted more ability to heal people. And he was a hunter. One of the things that he said once was, "Give me more anatomy." He learned how to use his hands to help people. A lot of people draw a parallel between chiropractic and osteopathic manual medicine.
Okay.
And there are some similarities. I actually myself spent 1 year in a doctoral program in chiropractic before I went to medical school because I didn't know that any medical school would take me because I was 56 years old. So I thought I might have aged out of an acceptable population. But as it turned out, osteopathic medical schools really like more mature students because they think they make better doctors.
They've been life experience.
Right, they've been around the block a couple times.
Sure, you're making a reasoned, intelligent decision, not a knee-jerk decision that a teenager might make.
And we're not necessarily limited to following a flow chart or a protocol. Those things can be really helpful, but in osteopathic medicine, we really want to focus on that person in front of us, and for sure they did not read the textbook.
I didn't know that Andrew Taylor Still was in fact an MD, and I think in 1892 or thereabouts he founded his institution. It's now a university up in Kirksville. Mm-hmm. And osteo means bone.
It does.
Essentially the foundation. Now allopathic, allo actually means opposite. Other variant, and pathos means to suffer. So allopathic medicine is kind of against suffering, yet osteopathic medicine seems that you're going from the foundation or the bones of the body to support health. Completely different attitude.
Yeah, it's interesting that osteo was the root for the word because, among other things, Dr. Still once said, the rule of the artery is supreme. So it wasn't like in his thinking he was limited to one system, that is the skeletal system. It was that he was going to use the neuromusculoskeletal system to help the body find homeostasis.
Homeostasis means maintaining health.
Yeah, it means balanced.
Yes, balance.
Or the ability to have resilience to find balance. Because the idea that we might have at any given time in medical history or human history about what perfect health is limited. We know it's limited because we keep learning about health all the time. And when my dad was a medical doctor, medical information doubled every 50 years.
Mm-hmm.
And apparently now it doubles approximately every day.
Every day? I thought every 10 years. I was way off.
We should look that up, but it's a very short period of time, and it's not years. It's
exponential,
short.
like these Moore's law of medical.
So how does a doctor keep up with that? Answer, you don't.
You don't.
There's no way. And so you try to find your sources that are going to feed you what you need to know. And then...
It's every 73 days.
73, thank you. So
thank you, Hunter. Every 73 days.
2.5 months.
Ha!
Thanks, appreciate that. So every 2.5 months, medical knowledge doubles. And what do we do about that? We have to learn how to help the person in front of us. They're going to tell me what's happening. I think I know stuff, and some of it's helpful, and some of it isn't necessarily. And so I want to hear the person's story at the levels that I need to hear it as a physician to understand what in my toolkit. Now I have several tools. What in my toolkit shall I talk to the patient about and ask them if they're interested in? Are we going to do functional medicine? Are we going to do some herbal medicine? Are we going to do some Chinese medicine? Are we going to do some family Western medicine? We're going to use medications. Are we going to use osteopathic manipulation? And are we going to do aspects of osteopathic manual medicine that are more subtle, where we work with fascia, where we work with the dura, for instance, the covering over the brain and the spinal cord? We can do that in manual medicine. So what, I have a great time treating migraine sufferers. Do I treat them successfully 100% of the time? No. I had particular trouble with a patient who was a young woman who had been a migraine sufferer since she started her cycle, and she wouldn't have stopped smoking. So we were kind of limited in what we could do. So it's real important to get with the patient what they are interested in, what resources they have, what resources I can provide them, and to try to keep learning.
Oh, I want to reflect on what you just said. You touched on some such important topics. One is having the time and the attitude to listen to the patient. I mean, in medical school, they teach us, 80 to 85% of our diagnoses come from the history, just the story that they tell us. And in pediatrics, and veterinary medicine, it's even tougher because the patient can't talk, but you have to listen to the parents, or the owner. But the information is usually there. And second is to have the armamentarium and the wisdom and to have the art of medicine. I like to say that medicine is informed by science, but isn't really scientific. It's not a scientific method, is it?
It's an N of one.
N of one.
The patient. Yeah.
We're not treating an average person. We're treating an individual.
Right.
Oh, man. So I heard that said that Dr. Still started osteopathy as a radical protest against medicine of the time. They had castor oil, opiates, like you said, surgeries that would have horrible complications, and he was sick of hurting people, and he wanted to help people. Mm-hmm. Well, I'll tell you, I had a thing happen last week. I had a patient that made me want to do a radical protest against the way medicine is treated. I treat mainly infertility, people with having trouble getting and staying pregnant. And I had a lady, I had her chart in front of me, and she was on a handful of diabetes medicines. She was clearly obese, high blood pressure, high blood sugar, all these problems. And sometimes people come, they just want to be treated. They don't want to be involved in their health. I don't know how smart they are, how active they want to be. So I had a Zoom meeting with this woman. She ended up being articulate and intelligent and lovely, just a beautiful human being. And I'm getting through all her medicines. And I said, have people told you, and she said, I asked her how she eats. She goes, oh, I love pasta. I live on pasta. And I said, has anyone ever mentioned to you, well, maybe you shouldn't be living on grains. Maybe you should be living on protein and fat because you're diabetic? She goes, no one's ever told me that.
Oh, heavens.
No one's ever told me. She's been with allopathic doctors for years. She's on thousands and thousands of dollars of medicine. She's only getting sicker because nobody has taken, and I believe her. I might say, oh, she doesn't remember. No, she was an intelligent, smart, thoughtful woman. If someone had told her to stop living on pasta, she would have told me that. No one had even taken the time, Sue, to try to get to a root cause of her problems. And I tell you, I wanted the radical protest in me came
I hear
out.
you on that. And, part of it's our system. When I was a temporary doctor, before I set up my own practice, I was practicing in New Mexico in an urgent care, and I saw 67 patients in one day.
Oh, my goodness.
Now, you can't help people when you walk in the door and say, hey, you have strep throat, here's your moxicillin. I mean, you haven't helped them learn how to not have strep throat.
Right.
Or other types of common problems.
Right.
So giving a diabetic information that complex refined carbohydrates and simple carbohydrates are probably not so much her friend. I mean, that's just critical, basic information to help to stop the progression of type 2 diabetes.
Yet they're just throwing drugs at her. Anyway, radical protest. So just talking about osteopathic physicians, apparently 11% of United States physicians have a DO degree. Tell me if I'm wrong, but there's about 33 colleges of osteopathic.
It's about that number.
It's about that. And before 1950, the American Medical Association considered osteopathic medicine a cult.
Yes.
Boy, they didn't like osteopaths.
Right.
And when I trained in the 80s and 70s and 80s, there was still this lingering prejudice. Let's just call it as it is. But apparently after 1971, the states, the licensing boards, gave osteopaths full medical privileges, virtually the same licensing requirements. A DO can become a brain surgeon or a family practice doctor. Obviously, people rise to their own level of competence and skills. So, Susan, I want to talk about your story. It's just fascinating. You went to medical school late in life. Did you practice any Eastern arts or energy arts or other practices?
Well, in 1996, I became a student of Tai Chi and Qigong. Most people know of it as Tai Chi.
Right.
It is the national sport of China, and it's practiced by over 200 million people there.
Do they also call it wushu?
Wushu is martial art.
Okay.
Tai Chi is also martial art, and they are related. So, let's see, what's that famous Shaolin? The Shaolin Temple.
Yes.
Wushu.
Wushu.
And Tai Chi is related to Wushu because Wushu, there are two kinds of Chinese martial art. One is called internal, one is called external.
Oh.
Wushu and Tai Chi Chuan are internal arts. That is, the focus in the development of the martial artist is on developing the Qi internally. And I told my students this morning, Tai Chi cannot be demonstrated. It can only be practiced. It's like yoga. What you see the yogi do is not what's happening. It's the last thing in a sequence of events. So a Tai Chi move is the last thing that happens. Everything is internal until the physical motion occurs. The Chinese teachers say, Yi Qi Li. This means the mind intention leads the Qi. You can think of that as life force.
Okay.
And Li is the external manifestation. So my mind says, okay, Qi circulate this way in the core of my body, and my hand does this. Okay. So this is not, it's not this. This is my arm.
That's the end.
Anybody can move their arm like this. But to have the 4 energies of Taiji, so sinking, neutralizing, and so on, pressing, all that, it's here. It's in the core of the body. And the foundation is on the ground. So I always pick the largest student. I would pick you, Dr. Gill, and I would ask you to hold my wrists down as firmly as you could. And then I would just stand up into my wrists and you would take 2 steps backward.
Yes.
Because all the force you put into me does not stick to me. It goes through my body and into the ground. And then as you exert it, it comes instantaneously up through my body back to you.
Oh, I studied Tai Chi when I was a kid, and I never got that. That is so beautiful and profound.
Well, what it takes is just a lot of time practicing the form. That's like the letters of the alphabet. Then the student can begin to spell words, so to speak, with motions. And then as they continue to practice Qigong and they're developing more and more life energy inside and dispersing stagnant energy and, again, helping themselves to that homeostasis where there's health and healing in the body. The more of that there is, then the more the Taiji is a form of Qigong. It's a form of healing.
And tell me more about Qigong. What does Qigong? Qi means this life energy.
Life energy. Gong, any Gong is like Gong Fu. You hear Kung Fu.
Oh, it's Gong. It's Gong.
Gong means it's any discipline that you devote yourself to that pays you back. So calligraphy is Gong. Gong Fu is Gong. Tai Chi Chuan is Gong. Being a chef can be Gong. Anything that you do that is an art, like medicine. Medicine is Gong. You devote yourself to medicine in the way of Gong, like discipline. It pays you back. And it pays you back in ways you don't necessarily anticipate. So, for instance, Dr. Gill, when you went to medical school, did you have the idea that you would be doing this kind of education for people?
I didn't know.
Right. So you did your Gong. You went to your classes. You took your examinations. You passed your boards. You did a residency and a fellowship. And that paid your patients back, and that pays you back.
Yes.
So there's this blurring of the lines between giving and receiving, where it's just a flow instead of you give, I receive, the separateness.
I'm getting all choked up, Sue. This is just beautiful. So you had this experience with the various gongs before you decided, gee, I want to be a physician now.
Right.
So you applied to medical school in your 50s.
I did.
Now, I looked this up. Apparently, if you look at the investment of society, not just what do you pay for medical school, but what does society invest in a physician? You know, all the residencies are supported and hospitals are supported. If you go, it's like $1 to $2 million. And I know admissions committees, they want to see a return on their investment. They'd rather have a 20-year-old come in. They can say, well, it's going to cost $2 million. We'll get 30 years out of this person.
Right.
We'll prorate it. How did you get the admissions people to say, hey, take a look at me, even though my actuarial table might be a little shorter than a 20-something?
Well, those were exactly the thoughts that I had applying for medical school. And I had really no idea. I knew I didn't want to be an MD because I wanted to do hands-on. I already knew how to do craniosacral therapy and lymph therapy, which are osteopathic modalities. So I was trained as a layperson in those 2 things. So I knew I wanted osteopathy, but I didn't have any idea. So I just took the MCAT and I applied. And what I found when I went to Lake Erie College was, first of all, they had a particular part of their mission was to put a whole lot more primary care physicians into the workforce.
Okay.
Because we've been looking ahead to this for over 20 years, and we now are actually in the doctor shortage.
Yeah.
And they wanted to help provide primary care physicians, and they had a special program to educate primary care physicians and to help relieve some of the debt burden on the student.
Yes.
So what they did was they had us go 3 years instead of 4 nonstop. So we didn't have any vacation.
No breaks.
No breaks. And then we had 8 fewer rotations. So we didn't really have true audition rotations. But I think that I felt caught up by maybe after 4 months in residency. There were some things I didn't know that I probably could have learned as a student in those 8 rotations. But I was able to recoup that during residency. So I didn't know that they were going to take me. I was just out on a limb because honestly, I had an experience while I was driving my car, and I decided that I would try it.
Would you tell me about that moment? These are formative moments. We all have them.
I did.
People downgrade them or poo-poo them, but they are life-changing. They're called burning bushes, angel moments. They go by many names.
Yeah, burning
These
bush is a
formative
good
moments.
way.
So tell me about this moment in your life, Sue.
Okay, I was in downtown St. Louis. I was being a table trainer for a lovely lymph teacher.
Table meaning you put people on the table,
yes,
and it's
we were,
another hands-on modality.
We were teaching people how to do lymphatic drainage, we call it.
It's a type of massage, let's call it.
Right,
perhaps.
like take swelling out of places in the body where it doesn't belong.
Love
That's
it.
a good way to think about it.
Love it.
So I was down there helping out, and I had lunch with my teacher, and she said, "So what are you doing these days?" And I said, "Well, I think I need a license to teach or to touch people in the state of Missouri." And she said, "Yes, you do," because I didn't have any formal medical training or anything, or even a licensed massage therapy thing. And I said, "So I guess I'll become a licensed massage therapist, and then at least people will know why to come and see me." And she said, she was a very sweet person. She just almost went nose to nose with me. And she said, "Don't you have a perfectly good osteopathic medical college here in the state of Missouri?"
And you do.
And I said, "My son is taking his white coat there in 2 weeks." So my son Joe went through osteopathic medical school 2 years ahead of me. But that's getting ahead of the story. So it's very intensive these weekends, and we did Friday, Saturday, Sunday. So Monday, I thought, okay, on Monday I'll be able to think about it. I was driving out to see a cranial client out in St. Charles, and she's a dear friend of mine. And I'm driving out there, and I said, okay, my teacher said, think about osteopathic medical school. And yeah, I thought about medical school when I was a young person, but then I raised a family, and I got a degree, 2 degrees in English literature, and I did all this other stuff. And I worked as an editor in a publishing house, and I don't know the money, all this. So, and then my mind would wander off. And I would pull my mind back. And there was a song, and I think it's the Doobie Brothers. It's "What the People Need Is a Way to Make Them Smile."
Yeah.
People get ready for the news.
Smile.
Yeah. People get ready for the news. Yeah. So I'm listening to this, I'm thinking, yeah, other people, it's kind of in my mind, Finally, I just said, you know what? I don't know how to make this decision. I guess I'll go home and talk to my husband. I just don't know how to think about this. And Gil, it was like a voice inside my head. It was like blue light saying, just think about all the people who would love to have you for a doctor. And I said, what? Are you talking to me?
Oh, my goodness.
And there was this silence, and I said, well, but I mean, I'll be old enough to be everybody's mom, and
the
halfway
self-doubt.
there to being their grandma. And there's silence like you listening to me. And I said, so you're telling me it's not about my age? And the answer was, that's right. It's not about your age.
Well, I'm going to sing, Sue. Oh, listen to the music. You listen to your music.
I listened to the music, and it was such a gift So I'm crying and I'm driving and I'm like, okay, but I get in the slow lane.
I am too now.
And I get out to my friend's house and I say, Rita, don't pay attention to the tears. Just something happened. She said, well, tell me. And I told her, and she said, well, I have been trying to tell you this for years. And I said,
you were the last to know.
You told me that I should be a doctor? She said, oh, yeah. So then I called my girlfriend on the way home in the exact same words. She said, well, I have been trying to tell you this. And I said, well, okay. So, Gil, I couldn't not try to go do those interviews based on a notion of how much would be invested and what kind of parameters the admissions people would care about, which I want them to care about that stuff. But that wasn't what I was focused on. What I was focused on was, I think I've been asked to be here.
A calling.
I think I've been asked to be here.
Oh, I'm getting chills. And clearly, these admissions people picked up on that.
I guess they did. They told me, they said, now you have a big life. Are you going to be able to let go of that to the extent that you need to be a medical student? I said, yes, I will.
Did you have children?
I have 5 children.
How old was your youngest child at that point?
My youngest child in 2009 was born in 88, so that's 12 plus 9. So he was 21.
They could make a sandwich and take care of themselves.
Oh, yeah. and because
so
I had to
move on.
I had to leave our hometown and everything. So, yeah. So I lived in Erie, went to medical school, and, they're all
And you
St.
did it in
Louis.
3 years.
I did it in 3 years.
So now you have this life experience with Qigong and Tai Chi and lymphatic and a year. Where did you do the year of chiropractic training?
I did it at Logan College in St. Louis. Yeah, Logan College.
Got the Midwest. I know there's Palmer up in Iowa, one of the founding colleges of chiropractic.
Right.
So we're really in a hotbed here of
we are
of forward thinking.
We are
in flyover country.
People don't think about Midmo that way, but really, when you look at it, Dr. Palmer and Dr. Still both came from this area. And osteopathy and chiropractic are 2 wonderful healing disciplines that contribute to people. Medicine is also extremely important. You asked earlier about the difference between medical training and osteopathic training. I didn't go to medical school. My dad was an MD. But medical schools, as I understand them, in general, of course, I don't know how helpful generalities are, but in general, are a little bit more focused on research than osteopathic schools. We're doing more research now, and we also have an extra curriculum where we all learn OMM, or Osteopathic Manual Medicine.
When I was a medical student in New Jersey, the osteopaths, for the first 2 years, studied with us. They took all the same classes.
Yeah.
And then they had to stay 2 or 3 hours later every day and do their OMT, their osteopathic.
Yeah.
What does OMT stand for?
Osteopathic Manual Therapy.
Manual therapy. So they did more training than I did.
Yeah. Our core curriculum is more training. Now, in medical school, frequently students are going on beyond their regular curriculum too, and they're participating in research projects and things like that. So it's just 2 kind of different styles, although the core sciences in the first 2 years are the same.
They're the same and have full equivalence. So let's talk about the philosophy of osteopathic medicine. I think osteopathic medicine looks at the body kind of as a whole, as a unit. I think there's an appreciation that the body, when it's working well, is able to heal itself, regulate itself. There's what I like to call an internal wisdom.
Yes.
Maybe a wisdom of the body that 3 billion years of evolution have imbued on us at least, right? And that the structure tells us about function, and reciprocally. Form follows function, function follows form, and all this stuff. So it really changes the dynamic to one of gee, here's a sick person, let me give you a drug to fix it,
Mm-hmm.
to, gee, here's a body that can heal itself if allowed to.
Mm-hmm.
Is that accurate?
Yes. One of my great jobs as a doctor is to get out of the way.
To get out of the way.
You said aloud.
Get out the way. There's a song with that lyric.
Yeah, get out of the way. One of the things I love about osteopathic modalities is that many of them are light touch. And it's amazing how the body will allow light touch. Think about the cranium, the head, the skull. If you hit it, it's hard. And it's protecting the brain and other sensitive structures inside the cranium. But if you put light touch on there, you can feel it move. And I know my dad was trained that in the adult, the skull bones don't move. But actually, the sutures between the skull bones are interdigitated. So it's like fingers meshing like this. And there's connective tissue in between the interdigitations, and that connective tissue is flexible.
I'll be darned.
And so 6 to 10 times a minute, the way osteopathy describes this is the cranium goes into flexion and extension.
I am blown away. I am blown away. I never knew this, but it must be true. I mean, it's a suture. There is inherent flexibility there.
There is. And the system, because the dura is not uniformly attached to the inside.
The dura is the coating of the brain, folks. It's a very kind of almost a leathery membrane around the brain and the central nervous system.
Yeah, its name actually means tough mother.
It's tough
dura
mother.
Mater, right. So it's there to protect, and it at certain points, it is attached to the cranial bones. And so when the cranial bones move, the dura moves. And the bones become handles on the dura, and the dura is covering the brain and the entire spinal cord, and all the nerve roots that come off the spinal cord has a dural root sleeve to start with. And then those sleeves are contiguous with other fascial tissues so that you can be here on somebody's temporal bones and their thigh fascia will unwind.
Oh my goodness.
So you can be anywhere in the body when you're on the head, and you can be in the head from anywhere on the body. Because the limbs move as the cranial bones move. At rest, the limbs also go into an external rotation during flexion and internal rotation during extension of the cranium.
Oh my goodness, this is reminiscent of reflexology, that the whole body is reflected on the foot, and that you can affect the up here from down there.
Yes, the mechanism is different.
Oh, tell me.
But the concept is similar. So we can describe cranial flexion and extension and limb external and internal rotation, and it's mechanical. Reflexology, we don't know a mechanism to explain it yet. Just like we don't, like you can do reflexology on the ear and treat the ear as an upside down fetus. Here's the head, here's the spinal cord.
There's a homunculus in the ear?
Yes. And actually battlefield acupuncture is based on that.
Battlefield acupuncture. Whoa. What is battlefield
We need to slow down,
acupuncture?
right?
Oh my God, my dura is stretching.
Okay, so let's be kind to it. And let's take us back to medical doctors.
Okay.
One named Nemtsov, who was an officer in the Air Force, invented a type of acupuncture called battlefield acupuncture for soldiers. And when they would put these tiny needles into the ears of soldiers immediately wounded and take them right off the battlefield, they would quickly put 5 needles in each ear. 8 out of 10 of them did not need opioids to control their pain before surgery.
I've seen little little bipolar stimulators of the ear and whatnot. And of course, my first impression was, well, this is kind of woo-woo, foo-foo. But this is real stuff.
It's real stuff.
Oh, my goodness.
And the literature is there. I'll be happy to give it to you after we talk. Nemtsov is the name of the MD who developed this. And of course, it's of wonderful use in acute and chronic pain. And one of the things that my partner, Elizabeth Allman, and I are working toward is, she's already doing medically assisted therapy so that people who are opioid addicted can come off of their addicting opioids and onto a substance that is also an opiate, but doesn't give any of the highs, if you will, but just jams the receptor.
Talking about Suboxone therapy?
It's, Suboxone and buprenorphine.
Yeah, that is life-saving.
Yes,
Life-saving.
And so the MAT, the medically assisted therapy, and the battlefield really help bring down people's pain level, because a lot of people are opioid addictive or innocently addicted because
it's not a moral failing at all. I mean, no. I say you give Mother Teresa enough OxyContin, she'll become dependent.
Right. Yes. That's part of how we're wired.
Yeah.
And we have endogenous endorphins. We have opioid-related things that you've heard of a runner's high.
And sunlight.
Sunlight,
Sunlight, and cufflinks. I mean, it's right there. It's right there. We know the biochemistry of it all. Just get some sunlight, and there go your enkephalins up.
Right.
So, God, this is such an enormous topic, Sue. I don't know where to begin, but let's say you're in practice. And your practice here in Columbia, Missouri, I want to say is still evolving. You're still working out. So I'm not going to say the name of your practice, but maybe in the coming weeks and months we can change the link down here to your project evolves. But let's say you're having a family practice, general practice day. You go, I assume you'll have an office. A person comes in with I hate to use the word complaint. You don't think they're complaining. They have an issue.
Right.
How do you go about this deciding which of these arts and modalities that you have will you employ? I guess that's too general a question. Let's say somebody comes to you mentioned migraines. Let's say somebody comes in with the complaint of a headache. How does Dr. Overkamp approach that? And I'll help you. First, I know you listen. So I know you listen. So there's a good start.
Yeah, I would do my best to elicit from the patient what their history is and what type of headache they have, how often, and so on. I would do all the things that any medical doctor would do. And then I'm starting to form an idea. Do they have just one type of headache? Do they have more than one type? And what do I know about what I might be able to do for them? And rarely, I might even say, you know what, I need to send you to a neurologist. Mm-hmm. But normally, most people who have a headache, most often, have what's called a tension type or stress headache. And so I explain, if they don't know about osteopathic treatment, I have very simple osteopathic treatments for tension type headaches. And I also teach people how to do stretches that can relieve the tension in the back chain that are often the cause of a tension type headache. There's a nerve that comes off at C2, has to pass through really thick fascia, and then it comes up like this. So a lot of people say, oh, I get this headache and it starts back here and then it hurts in the front or it hurts here. And I say, okay, well, let's see if I can help release that fascia a little bit and then teach you some stretches and teach you how to make a towel bolster and lie over a towel bolster, make your own headache go away. I had a lovely patient who's a retired police officer of the city of St. Louis. And she called me once and she said, Dr. Sue, I've had this headache for 8 days. And I said, Diana, where is it? How does it feel? What are you doing to help it be better? What makes it worse? And so on. And then I just taught her over the phone how to make a towel bolster. And she sent me a thank you note in the mail. She said, My headache of 7 days is gone. And I asked her later, has it ever come back? She said, if I even get the faintest hint, she goes, just lie down on my towel bolster and it goes away. Now, wouldn't it be great if all headaches were that simple?
Right.
And they're not.
We had Dr. Joel Schenker here, the neurologist. I was talking about headaches. He said there's like 326 types or whatnot. I was kind of blown away by that. But clearly, the more common ones, you have ways to deal with them.
Right there and then, usually.
Boy, I'm afraid to do this, Sue, but let's go for it.
Okay.
Let's talk about vaccines.
Let's talk about them.
I would love to hear your take on vaccines. And let me just back up a little bit here for the general lay office. The word vaccine comes from the word vaca. It means cow. And I believe Dr. Jenner back in the 1800s, maybe 1700s in England, noticed that the milkmaids weren't getting smallpox, and he figured out they were exposed to cowpox, and this virus from the vaca, eventually they figured out, supplied cross-reactive immunity to smallpox. And the idea, and they would take the crusts of lesions and people would sniff them. And so the idea of vaccine, very powerful. It's used to almost eradicate polio for a while there and other horrible diseases. But vaccines have gotten a bad rap. Compounding this, we had this national trauma of COVID.
Right.
And then we had this new technology that they called vaccines, but really aren't vaccines, as in a vaca, as in an antigen, an exposure to kind of the hair of the dog that bit you, but a technology where you can go in and actually program cells to make proteins, which is a very different mechanism from original vaccines. But they've called them vaccines. They've gotten blended together. And maybe with a broad brush, these new technologies have maybe smeared the old-fashioned vaccines or whatnot. So I see women who want to get pregnant, want to have a baby. They're susceptible to German measles. Horrible disease.
Yes.
Horrible, causes horrible birth defects all the time still, because it's a reservoir out there. And I recommend a rubella vaccine, which happens to be MMR, happens to be packaged with measles and mumps. And this knee-jerk reaction not to get it, ooh, that's a vaccine, vaccines are bad, has really changed the whole landscape. So now that I've kind of set up this incredibly broad topic for you, can you tell me what are your thoughts on vaccines? Maybe what is the osteopathic, holistic view towards vaccines? Educate me, please.
I think I'm going to start with, of all people, Benjamin Franklin. Apparently, within the last few years, somebody discovered some information about Ben Franklin's young son. This child was younger than 10. I don't remember if he was 7 or 9. And Ben was back and forth about whether to vaccinate him against smallpox, because people were dying like flies from smallpox. They were also dying from the inoculation. Because at the time, we didn't know how much to give, that sweet spot between ineffective and lethal. We hadn't learned yet. And actually, I think real progress was made toward the end of the 19th century in Germany by a man named Hahnemann. He was a physician, and he gathered other physicians around him, because in that day, doctors only experimented on themselves. They didn't view it as ethical to experiment on patients. So they experimented on themselves to try to find out what was the right dilution of whatever matter you're using to inoculate somebody with. How do you find just the right amount? They ended up learning all kinds of things about diluting substances, and they ended up calling their science homeopathy. And that's a subject for another day.
Yeah, the dilutions.
The dilutions. But back to vaccines, Ben Franklin decided after much time and agonizing to inoculate his son, and the child died from the inoculation.
Oh, no.
So we didn't really know how this child had died apparently until recently. When my patients come into the office and they ask me about this, I say, I have two hats. I have the mom hat and the doctor hat. And with my mom hat on, I'll tell you, I too had a child who had a vaccine reaction. She survived it. But her second, series as an infant, she had allergynia. She had a 102.5 fever. She was screaming. I couldn't touch her because she was so painful. Just changing her diaper was awful. She was a sick baby for several days. Fortunately, she did not have lasting effects.
Oh, thank goodness.
So here's what I want to say. And I'd love to know more about COVID vaccines because that whole RNA technology is new. And how that's different from, say, doing a dilution or a killed virus, for instance. We don't yet know how the newer vaccines actually work, meaning we don't know how they interact with, we don't know enough about how they interact with the human immune system. We're learning. And COVID-19 was a watershed in human history and in medical history because for the first time ever, everyone could watch the medical community learn about a novel virus and a novel disease. And so all the expectations on doctors that we know about diseases and we help people with them were shattered in many quarters because this was new. We had to learn how it was spread. Remember when everybody was scrubbing down their groceries?
Oh, every time we got a package in the mail, I'd leave it out in the sun. We didn't know how you'd catch it.
And then later we learned that basically it was droplet spread, respiratory droplet, and that basically once it hit the floor, it was pretty much not going to infect anyone.
Right.
And that made masking really important, and then we got vaccines and so on. So what I tell people is my other hat is my doctor hat. And with my doctor hat, I'll tell you as much as I can about what we know about the vaccines for your child. What we know is that 1 in every 100,000 has this particular complication. And your child is highly unlikely to have that complication, and they are more likely to have serious complication, for example, from measles, than they are to have a complication from the vaccine.
Okay.
So I do my best to give my patients information, and I make a recommendation that they vaccinate their child. I continued to vaccinate my children after my third child had her vax reaction. However, I vaccinated my children a little more slowly.
Yeah.
Sometimes that's a reasonable option for people. When children stay home, it's even more reasonable option. When they go to school, it's less reasonable. If they're going to get to the public pool, the polio virus is going to be in the kiddie pool.
Right.
So you have to think about these things. What's the child's exposure?
If it's there, that's where you'll find it. Yeah.
That's right. So I feel for people because wearing the mom hat or the dad hat, the parent hat, it's a difficult hat to wear because it's one child that you are charged to care for. And is that child going to be the one in 200,000 or whatever? You don't know. You don't know.
That's a very thoughtful answer. It's a very thoughtful answer, and I think we can agree that people of goodwill and intelligence can disagree and have slightly different approaches towards this. And then I think we're all doing the best. And I think the COVID thing really, people forget there were the hospitals were full.
Yeah,
they were overflowing. People were dying like flies. It was stressful on everybody, and nobody had the answer. We were all learning, and that's what science is about. We're all learning.
Right.
Well, there's another epidemic. It's an ongoing epidemic. It's an epidemic of obesity here in the developed world. as countries around the world get more westernized, I don't want to name a particular fast food restaurant. Let's just put them all under one label. Something is happening. Something is happening. I've been morbidly obese myself. I've battled that. I have very strong feelings on that, and talk about the conspiracy of big food and big ag and big government to foist, let's say, non-traditional diets on us, and the tyranny of the calorie hypothesis. I want to tell you something. When you have a code for a medical issue, it's a miscarriage, it's a headache, it's a broken bone. It's just what it says. But when you have a diagnosis of obesity, it says in the actual words, obesity due to consuming excess calories. The brainwash is in there. You can't even make the diagnosis without blaming the patient for gluttony. Yeah. Right. So I'm going to be, I have calls out and agreements to talk with a lot of people who are experts on this, and I look forward to podcasts in the future with a lot of big names who are some friends of mine. But what is the feeling on this subject from the osteopathic, holistic community or mindset on this? Once again, another broad topic. As if vaccines wasn't broad enough for you. Give me your feelings on what is the mindset on obesity. How did we get here, and how might we address it in a holistic way?
You asked for my feelings, and and by the way, the osteopathic community, I believe, is like the medical community. There's such a difference of opinion, of course, and practice. So my paramount feeling right now is one of chagrin.
Chagrin. There. I like that.
Because when people enter the healing professions, they want to help people. They genuinely want to help people. I think that's true of almost everyone.
Sure.
And the ability to help people resides in a number of things, good training and practice, but also the quality of information. And every human being has enculturation and expectations that arise from that. I think you laid a good groundwork when referring to your own experience. So the chagrin is coming from, I want and need to help my patients because contributing to the life in them also contributes to the life in me.
Yes.
So I want to do this. And how do I do this without seeming to blame or shame or something?
Right.
So I do want to listen. I want to hear, because every single person who comes to me to talk to me about what they call their weight has already tried a number of things, and they're not satisfied. So I want to find out where their barriers are to any care that the two of us might enter into. Is exercise hard? A lot of us are very sedentary. Do people need to hear about the thrifty genes that we humans have?
Yeah.
Do they need to hear that all these hundreds and thousands of years of human evolution have caused us to have genes that will save every calorie we possibly can?
That's how I approach polycystic ovarian syndrome, for example.
Yeah.
Their genes are there for a reason. They were beneficial at one time.
Yes, and we are, in fact, in general, designed for alternate feasting and fasting.
Yep.
And because we no longer fast, in general, as a culture, some people fast, but I mean, just in general, because we don't go through the cycle of feasting and fasting, our body is going to keep storing against a rainy day.
Right. Here comes the war, the famine, the pestilence, the drought, and they don't come very often anymore here.
and certainly in our lifetime, which is kind of how we see with those blinders. Although we do know that it's possible for humans at any point in time to be in a position where those thrifty genes are going to do their job and help us be the obviously very successful species that we are right now. So I just ask people if they know that about us, that our genes are going to cause us to store fat, because fat is a ready source of calories. There's almost twice as many calories in a gram of fat as in a gram of carbohydrate. So it's a good way to have something against a rainy day. Well, if you're not having rainy days, if we're not fasting, then what are we going to do? How can we shift? Are carbs bad? No. There are 3 macronutrients: proteins, fats, and carbs. None of them are bad. What happens is imbalance in the ratios among them that is disadvantageous to a particular person, given their genetics, their lifestyle, their thinking pattern.
The context.
Yes.
Context, not a hard concept to wrap your head around, but so important.
It is. Yeah, there's no hard-edged thing to give to a person who's struggling as they see it with their weight. And I also tell them, when we've made a nice plan for them, or they have some experience and they know how to tweak their plan, I say, hey, don't worry about the scale. You're going to start weighing more, because muscle weighs more than fat.
Right.
So BMI is not your guideline.
Yeah, it's another slave. You can be a slave to BMI.
Your core, I have a stepson who is an Olympic weightlifter, and his BMI is 32. He's nothing but muscle.
Right.
And he was been told by doctors he had to lose weight.
Oh, yeah. The Army will discharge men who are bodybuilders because their BMI is too high. And a body fat of 5 or something.
Right. So BMI is not your measure. The scale is not your measure. Your most important measure is, how do you feel?
Bravo.
Do you feel good at this weight? Do you have energy? Do you feel like you can do what you need to do in your life and what you love to do in your life? Is there anything you'd love to do that you can't do now? What is it? Tell me about that. Let's see how to get you there.
I love it. An integrated, holistic view of the problem. Well, Sue, we could talk for hours and hours, and maybe we'll have to revisit each other again. Are there any aspects of your practice of medicine that you would like to talk about a few more minutes? Is there anything that how you approach things, anything that you do that is maybe unique to you or special to you, that is a value, why people should look up you and your colleagues? Is there anything you'd like to share with us before we end this?
Well, thank you for that opportunity. I am practicing in Columbia at 1705 North Stadium with Dr. Elizabeth Ullman. She is an MD, family medicine doctor who practices acupuncture. I'm a DO, family medicine doctor who practices acupuncture. So if you have an, an interest in acupuncture, then you might look up one of the two of us. If you're interested in medically assisted therapy, Elizabeth has been doing that, and I'm learning.
Bravo.
So I guess I would say patients who typically find their way to me, and I'm more than happy to do standard of care family medicine, but patients I tend to draw to me are patients who have either flunked out of the medical system or can't find exactly what they're looking for their wellness or their healing. So one of the things that I do is help people with their nutrition. Are we going to be using nutraceuticals? Are we going to be using over-the-counter nutrition? Are we going to be using your diet? Are we going to use Chinese herbal medicine? Are we going to use Western herbal medicine? And then how about, how about that pain in your back You know, you're having hot flashes and you have pain between your shoulder blades. Yeah, that's related. Migraine headaches related to shoulder blades. So again, when I get the history, then I can tell which of my modalities I'm going to kind of put that out there. And a lot of times when people say, I'm not real big on needles, then I'll explain about the needles. I'll show the needles. I'll put the needle in me. They're still not big
on yourself.
Oh, yeah.
Good for you.
Yeah. If they're still not big on it, hey, how about some osteopathic treatment? And I teach you acupressure, which is where I started. I started with acupressure and applied kinesiology. I was 33 years old, a stay-home mom, had 5 kids, and people were getting on my table and they were getting better. And so that was kind of fun and kind of cool. And it, took me another 23 years to get to medical school. My dad used to say, too soon old, too late smart.
Yeah, old too soon, smart too late.
Right.
Attributed to Amish.
So I have Eastern medicine. I have Western medicine. And in Western medicine, I have osteopathic modalities. In Eastern medicine, I would love also to teach my patients how to do their own healing work if they're interested. I'm not trying to jam this down anybody's throat, but I just try to gauge the interest level of the person in front of me. I trot stuff out. Some of it flies, some of it doesn't, and some of it flies later.
Yes.
So you just never know. Put things out there and see what people might like to do.
Our patients are growing too. Well, Sue, what a delightful conversation. I have learned so much. I think I've just grown a new friend. What a kindred spirit you are. I'm just so full of respect for you and admiration and gratitude. We have you and your colleagues as a resource here in our town. And thank you for sharing your insights with our audience today.
Well, Gil, I'm really feeling the joy and the connection. I really want and need to be able to encourage people. I think people sometimes get a little beaten down by illness or the system. And I want to open doors for folks. So thanks for the opportunity. Really enjoyed it.
Thanks again.